think I got everything. Okay, it's recording. I'm gonna try to do a speed run here. Okay. Well, I'm gonna skip the stupid shit and just get right into the nitty gritty. Okay. So I've already introduced myself. I already hand wash. CDC guidelines. Okay. So the reason why I'm here, Mr. Moore. Oh, hold on. So the reason why I'm here today, Mr. Moore, is because I will be performing a sterile wound dressing change to prevent infection and promote the healing of your wound. Your wound, and your doctor ordered this, and the reason why we have to do this is to make sure your wound is healing, getting better, and to make sure it's also not getting worse. So I have verified the MD order for wound dressing change, and I have verified the solution type, 0.9% sodium chloride, expiration date not today. I verified that, and so, you know, it shouldn't take more than 15 minutes. So, do you have any questions before we begin? No? Okay. Are you in any pain today, Mr. Moore? No? Okay. Well, if my patient was in pain, I would, where the fuck is it? If my patient was in pain today, I would medicate with pain medication that the doctor has ordered, and I'll come back in 30 minutes and evaluate Mr. Moore's pain level, and again, and then begin. So, okay, if no more questions, sir, I'm gonna flip you on your left side, okay? And then I would have my supplies before I even get in here, but since he's already back there, biohazard bag. Put this shit to the side. Then I'm gonna get my Chuck's pad. She said cut it in half, but for video speed length, I'm just gonna fucking just half-ass it. The Shawnee pad, because this is what... Dude, the fucking air conditioning, bro. Like, the fuck? I don't even know. I don't even care. But am I going for prettiness right here? Just trying to get it. Okay. Now, before I even get into that, I'm going to take off these gloves, perform hand hygiene again, because I'm going to be touching the wound. Is that even recording in the spot? Let me see. Okay, yeah, I'm good. Okay. So then, now, Mr. Moore, I'm also going to have my measuring stuff ready, right here. Cotton swabs, measuring device. Okay, now I'm going to carefully remove the dressing like this, making sure I don't touch the wound on the inside or nothing. Making sure everything's parallel and even, so it comes off cleanly, right? And there's the packing inside. Now I will be assessing for coca, not the pat. No, I'm just kidding. So color, odor, consistency, and amount. So on here there is a Serra sanguinis is color is Serra sanguinis, no odor. Consistency is thin. Amount is scant, small, expected, medium, and copious. On the ABD pad, right? I would close it like this, throw it away. Now in here, I'm gonna pinch just this. I wouldn't touch here, just this. Such for coca again. Odors, color is Serra sanguinis. Odor, no odor present. And then consistency is thin, scant, small, and expected. And the same in the wound, right? Yes. Now I'll be assessing the wound edges. Wound edges are rolled, I guess, I think. Now I'm assessing the wound. There's healthy granulated tissue. The wound edges, I'm gonna be assessing for the wound edges. They're rolled. There's exudate, slough, eschar. they're present, no induration or swelling present. Now I am going to begin to measure my wound, starting at the 12 o'clock position. 12 o'clock is towards the patient's head, 6 o'clock is down here. I'll grab my Q-tip, right? I would avoid touching. The only thing that's gonna touch is my fingers right here on the skin. And snapshot. I'm gonna measure the longest part of the wound. Okay, and then I'm gonna compare over here, my ghetto ass ruler. That's about 10 centimeters per length. Then I'm going to assess the width at the 9 o'clock to 3 o'clock position. That's the wide part of the wound, widest part of the wound. And then assess over here. It's 8 centimeters in width. Throw away my Q-tip. Next, I am going to measure the depth. And then I'm gonna get another Q-tip, right? And I'm gonna touch the bony prominence, right? And then slide down with 2 fingers, making sure I don't touch the wound. Only the cotton swab touches the wound. My fingers don't. And then I'm gonna measure. Okay, that's about 1.5 centimeters. Next, I'm going to measure for undermining and tunneling. And I see undermining. I'm gonna get another Q-tip, by the way. Next, yeah, so my third Q-tip. Next, measure for undermining and tunneling. And I see undermining from the 10 o'clock to the 2 o'clock position. And so I'm gonna stick my Q-tip in there. Measure. Depth is about 2 centimeters. Throw away this Q-tip, grab another Q-tip. And I see tunneling at the 7 o'clock position. So I'm gonna stick my Q-tip in that one. And the depth is about 5 centimeters. Throw that Q-tip away. Now I am going to cleanse the wound. Throw away my ruler. Yeah, I'm gonna, okay, yeah, now I'm gonna cleanse the wound. So I'm checking the MD order again. Solution, 0.9% sodium chloride, and it is not expired. Okay, good. Now I am gonna open my irrigation tray with the piston syringe right about here. And then I'm gonna open it away from me, 1-inch border, right? Kind of set this up like this, you know, like this, right? Then I'm gonna have my 2 gauzes, sterile gauzes. I'll mention why. Then, yep, my solution, palm to label. Now I'm gonna lip it about 1 to 2 mLs in my biohazard bag. Okay, it's lipped. Now I'm gonna pour like a good amount in here, making sure it just touches in there. Okay, now I'm gonna set this over here by my sterile gloves so I can prepare these bitches later, right? And then now I'm gonna take my syringe, right, and then fill this up all the way, right, like this. Thumb in the ring, middle finger and ring finger over here like this, holding the prongs. Then I'm gonna take one of my gauzes and I'm gonna put right here to catch any runoff. Then I'm going to hold my syringe properly. Yeah, okay. Now I'm gonna cleanse and irrigate the wound in a back and forth motion, starting from most contaminated to least contaminated with 400 cc's of irrigation. I'm gonna, yep. So I'm not gonna wet him because I have to sleep with him. So I'm just gonna pretend. All right. Then I'm catching all the dirty runoff, right? That's like coming out of the wound. I'm gonna put this shit back. I'm gonna throw this motherfucker away. Then I'm gonna get my other one and I'm gonna just pat the skin around the wound, right? We don't want any moisture, you know, pressure ulcers and shit. So throw that shit away. Then now I will throw all this bullshit away. So I'm not gonna throw it away, but I'm just gonna like put it under my bed or some shit, right? now I'm gonna be setting up my sterile field. Before I do that, I'm gonna take off these gloves. Hand wash procedure guidelines. Oh, I should actually take them off now. So this is my gauze and shit. Like, I'm gonna open it, you know, sterilely, like this. I'm gonna put it over here actually. This seems like a better route. Chucks is still there to catch any dirty shit. Then I'm gonna get my dressing tray instruments with ABD pad. And I am going to put this motherfucker right here. Okay, then I'm gonna grab this drape and grab only at the border, 1-inch borders. Kind of open it, avoid touching anything except the edges. And I'm gonna set it, fluff. Hold on, fluff. That was really fucked up, but there's air conditioning in here, so you know. There, and if it's over the edges, I would fix it, but it's good right now. Next, I am going to, don't go over the field, you got the field now, don't do this shit. Do this shit. Then I'm gonna grab my packaging like this. And then I'm gonna dump it 6 inches off the field, just like that. No! Okay, well, since that happened, I broke sterile technique. I need a new tape. I would ask a classmate to get me a new one. So they would open a new one sterilely and dump it right there. Okay, 6 inches off the field, whatever. Then if I'm gonna throw this shit away, I'm gonna go around the field, throw it away. Now, I'm gonna check it again, 0.9% sodium chloride, expiration date not today. I'm gonna lift this motherfucker again, French kiss, 1 to 2 mLs, away from the field. Right, and then I'm gonna pour 2 to 3 mLs in my sterile gauzes, right, and then just, I don't know, throw this shit away. Next, I am good. Let me turn off the air conditioning, bro. This shit's ridiculous. Okay, because that shit keeps doing that. But now I'm gonna put on my gloves. And as I said, wash my hands before I do this. I'm gonna open it sterilely. First one is away from me, and I'm gonna open it in a way so it stays put and doesn't fold back in on itself. This one away. Always be mindful of the fucking field. Now, it's like that. I'm gonna grab over under here, under these things. Don't touch anything but these things. And then do this. Yes. Now, I know I broke sterile field right there. Dude, get this shit away from me. Go on, get out of here. Then I'm gonna pinch the glove, right? Just touching the glove, not the paper. Right. Sorry about that. And then torpedo, wiggle my way in here. Yes, torpedo. Doing this, right? Boom. I committed. So I'm gonna go with that. And I'm afraid of commitment, as you can tell. I'm just kidding. Now I'm gonna scoop under the cuff. Torpedo. Commit, right? Boom. And if I want to throw this away, pinch in the middle, avoiding touching anything else, right? Like this. Go around the field. No, I'm good. Okay, we're good. I got my shit set up. Now I'm gonna set it up in the position I'm gonna use it. ABD is second to last. Blue's gonna be facing up, so I would put the blue down right here, right now. But no, actually no. Blue facing up, so I would put the blue facing up right now. Tape right here at the end. I'm not using that, don't care. I'm gonna get my forceps. Don't touch me, I'm sterile. So then I'm gonna come over here, only touching sterilely inside what's in here. Roll up like a dumpling. Right, I know, I'm just, for time's sake, I'm just doing this bullshit. And I would know how many I put in there. In the clinical setting, I would cover the whole wound with this bullshit. But she said only three dumplings, whatever. I would avoid the wood edges. I would avoid the edges here too. Done. I'm gonna throw this shit away. That shit's thrown away. avoiding the sterile field. Now, I am going to put the ABD pad blue line to the sky. Dude, I'm gonna just do this shit, okay? Yeah, right there. Then I'm gonna get my tape. And then fucking, I know I should have preset it up before, but it's a little lit. She said putting on sterile dressing is an art, but I am not artistic. Mommy is the freestyle. Hey, hey. Oh, oh, mommy. Dime por qué te fuiste. You can do this shit now because you're not sterile anymore, obviously. You can touch the skin and all that bullshit after the ABD pad goes on. When the ABD pad goes on, you're not sterile anymore. So, I know this shit's ugly, but for time's sake, I don't care. And then the last thing, I'll get my Sharpie. Initials, I don't know, I'm just gonna say 0900 for the time. Today is 9/11, 2001. Yes. You can fuck over, now you can do this shit over the sterile field, but, you know, if it helps you guys, just pretend it's still sterile. Initials, time, and date. Put that shit just right there. Not on the ABD pad, but right there. Next, dispose of your things. I would dispose this somewhere else other than there because it's a sharp. Dispose, 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 dispose. Right? And the bottom has your back. Flip his ass back. Yeah, you end it. Hand wash again. There you go. End it, end it, end it, end it. No! Did it stop fucking recording?